Hello, everyone. This is Dr. Michael Wald, and welcome to Ask the Blood Detective. Today's podcast topic I call Fatigue, Facts, and Cures. For those of you who are new to the podcast, again, my name is Dr. Michael Wald. I practice in Chappaqua, Westchester, New York. I've been practicing in the area of holistic health for a little bit over 30 years. I've been to chiropractic school, medical school. I've learned acupuncture, nutrition on a number of levels, including board certifications and master's degrees. What all of that has allowed me to do over the years, particularly relative to today's topic of fatigue and its causes and cures, is appreciating the myriad of influences upon our physiology that ultimately result in fatigue. So my sense of the general population is that they are quite ignorant in the vast majority of what actually can cause fatigue. And what that means, if you don't know the cause or causes, you can't exactly treat it. So what we're going to do today is I'm going to start out with, first of all, just defining fatigue, and then talking about some very common causes of fatigue, and then how we might manage some of these causes, and also the top 15 or so causes of fatigue in men and women, because they're not all the same. And fatigue by any other name is, not fatigue. So we need to know what the medical and or nutritional or other physiologic causes of fatigue are, so that we can figure out a plan to put together to manage it. And again, I've said this during all of my Ask the Blood Detective podcasts, is that my goal is so that you can become your own blood detective, will know the questions to ask, or will recognize in your own thinking when there's a gap, and that recognition will have you then research so you can move forward with your health in the most well-informed and educated way. You also get to have a more intelligent back and forth with various healthcare providers. Let's say you want them to do certain types of nutritional tests. If you can't talk about why, that's a problem. So, okay, let's start with, as I said, a definition of fatigue, because we've got to start somewhere. So fatigue, I believe, could be looked at as a state of feeling tired or weary or exhausted. It can result from physical and or mental exertion issues, a lack of sleep, prolonged stress or illness. Fatigue can manifest as a general feeling of tiredness or as specific symptoms such as muscle weakness, dizziness, headache, and difficulty concentrating. So fatigue may actually look like difficulty concentrating. Fatigue may look like a headache. Fatigue may not always look like exhausted or weary or tired. That's very important. So you want to think of fatigue as an energetic issue, and depending on where in the body the energetic issue is manifesting, you might have symptoms associated with those areas. So for example, if there's areas of energy balance, let's say in the brain, you might have difficulty in concentrating or have headaches. You might even feel dizzy. Okay? And fatigue in general, it can be acute, meaning short term, maybe a couple of weeks, or chronic or long term, which is several weeks or months or even longer after that. And it can significantly impact an individual's quality of life and overall well-being. So let's dive right into various causes of fatigue. These are pretty common ones. Physical exertion, for one thing. Engaging in strenuous physical activity can lead to fatigue due to depletion of energy reserves and the buildup of metabolic byproducts in the muscles like lactic acid. So that can cause fatigue. And then there's mental exertion. Prolonged periods of intense mental activity, such as studying, let's say for exams, or working on complex tasks, can lead to mental fatigue. And then there's lack of sleep. Inadequate or poor quality sleep can result in fatigue due to the body's inability to restore energy levels and repair tissues during rest. And then, of course, stress. Chronic stress of any type, whether it's emotional or physical, can lead to fatigue because the body remains in a heightened state of alertness, leading to the overproduction of stress hormones like cortisol that can deplete energy reserves. And then there's medical conditions, various medical conditions such as anemia, hypothyroidism, low thyroid, chronic pain syndrome. Again, it's not so appreciated, but chronic pain alone can cause fatigue. And infections can cause fatigue as a symptom as well. And then there are mental health issues that are associated with fatigue of different types. So conditions like depression, anxiety, and other mental health disorders can contribute to persistent fatigue and just lack of energy. And then, of course, there's diet and nutrition. So obviously, poor dietary choices or inadequate intake of essential nutrients can lead to low energy levels and fatigue. And then medications. Certain medications may have fatigue as a side effect. Many hundreds of them do, if not thousands. And that will impact an individual's energy levels. And, in terms of the symptoms, what you can observe in someone when they're fatigued. So sometimes you can see that they're persistently tired, they're weak, they may lack motivation, they may have difficulty concentrating, they might be irritable. And these are important things, right? Because when we're in communication with people during the day, they may have one or the other of these fatigues, and one person's fatigue is showing up as irritability, and we have a conversation with them and we take it personally. So, it's kind of nice to be aware that a person might have fatigue in the background, particularly in this day and age with all the stress that we're dealing with. Fatigue might also just look like headaches, as I've mentioned a few times, along with muscle aches and pains. Fatigue can look that way because the same physiology that causes one to perceive fatigue in their brain is the same one that may cause muscles to become depleted and their chemistries to change so that they are achy and they have pains. Dizziness as well can be a symptom of fatigue, along with impaired hand-eye coordination. So how do we manage fatigue? So I think it's fair to say that effective management of fatigue is going to involve addressing its underlying causes, right? So this might include lifestyle modifications such as improving sleep hygiene, engaging in regular physical activity, managing stress through relaxation techniques or therapy, addressing any underlying medical conditions, and ensuring a balanced diet with adequate hydration. So in cases where fatigue persists despite these measures, I think it's important to seek medical evaluation to rule out any underlying health concerns that might be contributing to these symptoms. So don't ignore chronic fatigue. Fatigue can have a significant negative impact on one's life, affecting various aspects of an individual's well-being and daily functioning. Here's a couple of the ways I think we should talk about and think about in which fatigue can negatively impact one's life. First is just physical health. Fatigue can weaken the immune system, making individuals more susceptible to illnesses and infections. It can also exacerbate existing health conditions such as diabetes, heart disease, and chronic pain. And then there's one's mental health. So chronic fatigue can lead to anxiety, depression, and other mental health issues. It also affects cognitive function, including memory, concentration, and decision-making abilities. These are main and major factors in quality of life that are being impaired here. And then there's work and productivity. Fatigue can reduce productivity, increasing absenteeism, and can lead to poor job performance. We know this for years in studies. It can also affect an individual's ability to engage in leisurely activities and hobbies, leading to a decreased sense of fulfillment and enjoyment in life. And then relationships. Fatigue can strain personal and professional relationships, leading to conflicts, misunderstandings, and isolation. Given how just strongly fatigue can just ruin a person's life, we must become blood detectives in figuring out if ourselves or those around us are suffering from fatigue, which are then giving us a false sense of relatedness to them, which can just ruin relationships. It's just a cascade event. So I think this information about fatigue is really it's an obligation for us to actually look for fatigue in ourselves and others, not just something we would do as a small part of our health. And then, of course, there's sleep. So fatigue can disrupt sleep patterns. Sleep pattern disruption will cause fatigue, leading to insomnia, sleep deprivation, and other sleep disorders, which, of course, affect cognitive function and can raise blood pressure and all kinds of problems. And then finances. We know that chronic fatigue can lead to decreased income due to reduced productivity, absenteeism, and just job loss. And, okay, so what now are some of the medical conditions that are associated with fatigue? First is chronic fatigue syndrome. So This pretty complex disorder, I would say, is characterized by extreme fatigue that doesn't improve with rest or may worsen with physical or mental activity. And that fatigue usually has to exist at least 6 months or so, depending on the definition of chronic fatigue syndrome at the time of this podcast presentation, and doesn't have any other secondary cause. Like, let's say the chronic fatigue is caused by low thyroid, or the chronic fatigue is caused by iron deficiency anemia or protein deficiency anemia. If the cause of the chronic fatigue were caused by any of those three things I just mentioned, we wouldn't call it chronic fatigue syndrome. Okay, and then there's just chronic pain. So conditions like fibromyalgia, arthritis, or chronic pain disorders can lead to persistent fatigue due to constant discomfort and physical strain. And then various sleep disorders. So conditions such as sleep apnea, restless leg syndrome, a very annoying syndrome, or narcolepsy can disrupt normal sleep patterns, leading to fatigue during waking hours. And then just to reiterate, poor nutrition, a lack of either macronutrition or micronutrition, the macronutrition being protein, carbs, and healthy fats, and the micronutrition being vitamins and minerals and other nutraceuticals. That, of course, is going to lead to energy production problems and fatigue on a number of different levels, as will dehydration. Very, very profound dehydration, just with a few percentage points of being dehydrated in terms of fatigue. And then heart disease. So heart conditions such as heart failure or coronary artery disease can lead to fatigue due to the heart's reduced ability to pump blood effectively. And then there's diabetes. So now we're looking at a bunch of different conditions that produce fatigue in some similar ways, but usually just very, very different ways. So lots of different problems can cause fatigue in the body. And often these are interrelated with multiple other problems. And each person's cause of fatigue or causes of fatigue must be identified and must be managed for the best chance of cure. And we have, again, diabetes, because we have both type 1 and type 2 diabetes, which can cause fatigue due to fluctuations in blood sugar levels and the body's inability to use glucose effectively and the inflammation involved. There's so many other concerns in diabetes that can cause fatigue. And then chronic infections, persistent infections like HIV, hepatitis, mononucleosis can cause ongoing fatigue. And medication side effects, certain medications, including antihistamines, antidepressants, and sedatives, can cause drowsiness and contribute to fatigue. And then cancer. So fatigue is a very common symptom in cancer patients. And that could result from malnutrition. It could result from toxic effects of chemotherapy and radiation. It could be secondary to surgery and healing. It could be from pain. It could be from inflammation. It can be from malnutrition. There's so many causes of fatigue within the cancer circle, you might say. And you really want to keep in mind, it's just essential to note that all of these causes are not exclusive to either men or women. They can affect individuals regardless of gender or age. Additionally, individual experiences with fatigue are obviously going to vary from person to person, and even from that person from time to time, and other factors. So let's deep dive into some specifically nutritional causes of fatigue. And I'll also mention some of the laboratory tests that are useful to discover nutritional deficiencies or insufficiencies or imbalances. Okay? For those of you joining us, my name is Dr. Michael Wald. You're listening to Ask the Blood Detective. I'm a holistic practitioner practicing nutritional therapies in Chappaqua, Westchester, which is an hour north of New York City. My phone number is 914-552-1442, and my email is info@blooddetective.com. The website is drmichaelwald.com, drmichaelwald.com. Okay, nutritional causes of fatigue. So we already know that fatigue can be caused by a variety of factors, and nutritional deficiencies are among the most common culprits. So when the body lacks essential nutrients, it can lead to decreased energy levels and overall fatigue. So there are 10 major examples of nutritional causes of fatigue that I wanted everyone to hear about. The first one is iron deficiency, because iron deficiency is the most common deficiency leading to iron anemia on the planet. So it's important to know that. So iron is crucial for the production of hemoglobin, which carries oxygen to body tissues. And An iron deficiency can lead to iron anemia, which will give us fatigue and weakness. The blood tests for iron anemia are usually the hemoglobin and or hematocrit are usually both low. The serum iron may be low, usually is. And if it's very, very severe and long-lasting, then the person's serum ferritin, which is a storage form of iron, will be low. And then there is vitamin D deficiency. So vitamin D plays a role in energy production, and its deficiency has been linked to symptoms of fatigue and low energy levels. Most people are surprised to hear that. Well, first of all, when the body activates and deiodinizes T4, which is tyrosine, an amino acid, with 4 iodines, T4, so that's a thyroid hormone. And then there's T3, which is the tyrosine amino acid, and 3 iodines. So there's T4 that has 4 iodines attached to tyrosine, and there's T3 that has 3 iodines. When the body deiodinazes, that means it takes one of the iodines off of the T4, so it becomes T3. That T3 is now the active free thyroid hormone. And that enzymatic step from removing an iodine from T4 to make T3, that is vitamin D dependent. Among other nutrients, but so you can see that vitamin D is critical for the production of energy in the thyroid gland through thyroid metabolism, but also in other areas of the body. And there is a good test for vitamin D, which would be a serum level test on the blood. You want the vitamin D range is usually from 30 to 100. Some doctors that are really not thinking will say that if you have a 31, you're fine, or a 33, you're fine. They certainly know that 50 is ideal in their minds, and that is a good number to be 50. You certainly don't want to be less than 50. And you really want to be up to 70 or even 95 because we know that the higher normal your vitamin D level, the lower one's risk of dying of anything. So you need to know that. So meta-analysis, which is a type of study that eliminates the poor studies that were poorly designed, which showed a lot of bias and that for other reasons are not really usable, and look at the good ones and go through that meta-analysis process have said a 70 is where you really want to be on the blood. Okay, now let's talk about vitamin B12 deficiency. So vitamin B12 is essential for red blood cell formation and for neurological function, also for memory. And if you have a deficiency in B12, that's called a B12 anemia, okay? So many doctors will just rely on standard serum blood tests of B12, so a serum B blood test level, B12 level that is. And as I've mentioned in other podcasts, the best way, I believe, to see if the person needs B12 and or has a problem using or activating B12 into the active form that the body needs is by doing a peripheral blood smear, which involves taking a sample of blood on a slide, a smear, and looking at it under a high-powered microscope, usually at about 400 times magnification, and looking at the size of the red blood cell. If the size of the red blood cell is large, so the cell is called a cyte, and if it's large, it's called macro. Macrocyte is a large red blood cell. So if a person has a large red blood cell and their serum levels of B12, which you can think of as outside of the red blood cell, let's say they're normal, or they can even be high. But if the red blood cell is large, that could mean that there's a deficiency of B12 in the red blood cell, and that's where you want it. So you might give more B12 that might make the plasma level around the red blood cell even higher, but it might force the B12 into the cell itself, causing the red blood cell to go back to its normal size where it's functioning the best way. Also, I like to look at a homocysteine level because homocysteine can tell us if we have an issue with using either B6, B12, or folic acid. So a combination of these tests might make sense depending on the individual's needs. So we would not want, this is important to say, we would not want to do the same type of testing on every person because they're not the same. So I might do a different combination of B12 tests in one person because the rest of their health history makes me think that this test plus that test would be better for them. But another person, I might do different B12 tests. So again, this comes with clinical experience and it comes with knowing what the medical and nutritional literature says. And then there's magnesium deficiency. So magnesium is involved in energy metabolism in the body. It's involved in almost, over 500 different enzymatic reactions that run different things in the body. And its deficiency, certainly among other symptoms, can contribute to feelings of fatigue and low energy. So you can do a serum magnesium level, which is okay for some. Sometimes they'll have a normal blood level, but you give someone more magnesium and they do better. So not everything is based on levels, but certainly if you have any outright deficiencies anywhere, you'd want to fix them. There's also a magnesium urine test. You can you can search my website for more about that, which might be a better test. It's sort of like a magnesium saturation test for some conditions. And then there's dehydration tests. So inadequate fluid intake can lead to dehydration, which can cause fatigue and decreased physical performance and just feeling terrible. And the testing for dehydration would include the blood urea nitrogen, or BUN, blood urea nitrogen. If that's elevated, that might mean that someone is dehydrated. They also might have a renal or kidney problem. And then also looking at the minerals or the electrolytes in the blood or in the urine, they might be diluted. My apologies, quite the opposite. There might be hemoconcentrated in deficiency. So you might see what look like high levels of minerals in the blood, which is actually not caused by too much minerals in the blood per se, although it may clinically turn out to be the case. It's caused because of dehydration concentrating those minerals. There are plasma and serum tests for all of the mineral levels. Let's talk about low protein intake. What's a good way to figure that out? Well, there are blood tests for protein. For example, there is the total protein, which is a serum test, and that has some use. And it's the total of the measurement of two different proteins in the blood, albumin and globulin. So albumin plus globulin equals the total protein. So if the total protein is low, it could be low because both the globulin and the albumin are low, or because one or the other of those are low. Okay, but the best overall way, I believe, to determine protein need and ultimate use of protein that can be said to be accurate for predicting morbidity and mortality, it's a really good test, would be a body composition test. So a bioimpedance test is another name, because there's an electric current that's used that goes through the hand and the foot on the right side of the client's body that are attached by electrodes, similar to EKG pad electrodes. And a current is sent through the body, and it goes through muscle, water, and fat at different rates because the density of muscle is more dense than fat, which is fat is more dense than water, etc. And then based on the movement of the electric current and then that information being fed to the computer, quite a lot of data is figured out. Basal metabolic rate, percentage of muscle, water, fat, the amount of water in and out of cells in the body, something called a phase angle test, which is a test that is very useful for predicting health and unwellness by pretty much measuring the energetics coming off a cell. And there's more that the bioimpedance shows. And we know that no matter what a person does, this is important that you hear this, everyone, no matter what a person does to improve their health, whether it's diet or meditation or Wim Hof breathing, whatever it is, doesn't matter. If it doesn't result in an increase in lean body mass, it's not increasing lifespan or health span, which is morbidity and mortality. So if someone is sick and they come to me and I do a body composition test and I look at their diet and I estimate that they're taking in a certain amount of grams of protein per their kilogram of body weight, and if they are underweight, I need to increase the number of grams of protein per kilogram of their body weight to have them get larger. And when they do get bigger and more muscular and the organs are also fed this protein from the diet, then that is where the biomarker tests of bioimpedance will show an improvement, and an improvement that is usually associated, as I've mentioned, with living longer and better. And then there is low carbohydrate intake. So carbohydrates are the body's primary source of energy. Insufficient carbohydrates intake will lead to feelings of fatigue and low energy levels. And, the serum glucose level is a common test used to look at blood sugar. It's almost always done fasting by mistake for doctors' offices by not warning patients to fast for 6 or 8 hours, or at least relative to their last meal to get the blood testing. And that'll let you know what the glucose is at that moment in time. If it's too low, it could mean low carbohydrate intake. It could be malabsorption. It could be many things that could cause a low blood sugar. And there is, of course, the hemoglobin A1C test, or glycohemoglobin test, again, more popularly known as hemoglobin A1C, which, if is too low, can show that there's been a chronic state of hypoglycemia or low blood sugar. And if the hemoglobin A1C is elevated beyond 5.7%, that's considered borderline diabetes, then someone has hyperglycemia in the pre or diabetic range. Okay, and when we're talking about sugars, that's what we mean about carbohydrates. And then there are tests for omega-3 fatty acid deficiencies. Omega-3 fats play a crucial role in brain function and reducing inflammation, lowering cardiovascular risk, and also helping to produce energy in the body. And so if you're deficient in omega-3 fatty acids, you may have fatigue and mood disturbances, among other symptoms. So there are tests, there are blood tests for fatty acid derivatives, from omega-3 and omega-6 and omega-9s and all the breakdown products of those sub-fatty acids in the body. I don't find these tests useful because most of the time I'm going to give people omega-3 fatty acids anyway. If they have more cardiovascular issues, I'm going to give them fatty acids that are higher in concentration of the EPA. So remember, fish oil is composed of EPA, DHA. So generally speaking, if someone has more cardiovascular issues, you give them fatty acids of omega-3 type that are higher in EPA. And if they have more neurologic conditions like schizophrenia or bipolar or depression or anxiety or anything special needs, you would give them the DHA portion more. And also pain, neurologic stuff, anything other than cardiovascular, probably more DHA as a general rule. Okay. So what other tests do we have? We have blood pH. So, we talk a lot about pH in the body, and you hear that we all should be alkaline. And any of us that know any amount of basic chemistry should be insulted by that statement because it's just dumb. What's dumb about saying that we want to be alkaline? Well, okay, besides the fact that it's dumb because in our mouths, we do actually want to be on the alkaline end of things because an alkaline pH in the mouth is the conditions needed in the oral cavity for amylase, the starch digesting enzyme, to be activated. So that is true. And we want to actually be on the alkaline side. A higher pH, right, is alkaline, and the lower pH is on the acid end in the urine. So we want to be on the acid end in the urine. So if your pH gets too high in the urine, alkaline, that is not a good thing. That can lead to urinary tract infections, for example. They're also associated with kidney stones. So that's one example of we do not want to have a high pH or an alkaline or be alkaline in the urine. That's why we take acidophilus, so the acid could lower the excessively high alkaline pH in the urine produced by bacterial infections, for example, allowing it to lower that pH with the acid products of the Lactobacillus acidophilus probiotic, and that could cure urinary tract infections by 30%. So that's pretty good. And then we have pH in the blood. Well, the blood pH is very tightly controlled between 7.35 and 7.45. So the average between 7.35 and 7.45 is 7.4. So let's think of 7.4 for blood. And if you're even 0.1 or more low or 0.1 or more higher, dramatic changes in how and body health can occur. Because enzymes in the body that are in contact with the circulation of the blood, they need a 7.4 pH environment. So if you've got a pH that's too low, which is called metabolic acidosis, that can lead to fatigue, weakness, muscle soreness. And when the body's pH levels are too low, it can disrupt normal physiologic functions, can lead to a decrease in energy production everywhere in the body. And that's because many of the body's enzymes and chemical reactions require a specific pH, as I've just said, to function properly. And then I like moving along from pH. Before we do that, we also want a acid pH in our stomachs. We don't want an alkaline pH. When people take alkaline water, by the way, that's one of the dumbest things you can do. Because what alkaline water does is it dilutes the acidity in the stomach of stomach acids, and that's going to impair digestion. And that could cause malnutrition and malabsorption. And if you do it all day long, like a lot of people do because they get a little obsessed, it's the neurotic types that tend to drink alkaline water all day long, that's what happens. So I had a patient who had breast cancer, and she was drinking this alkaline water, which I confirmed that its pH was not, in fact, alkaline, and she was drinking this. And, alkaline water can cause calcium accumulation in the breast and in other areas of the body, and that is counter to breast cancer therapy. There's much more I can say on this, but we just don't have time today. Just a few more tests. Urine levels of vitamin C. So basically, if you have vitamin C in the urine, that means the body's saturated, so it's getting rid of some vitamin C in the urine. You want to be saturated. You don't want to be 50% saturated. You don't want to be 75% saturated. So the vitamin C test is not a perfect test, but it's something. And then also I like to measure in the urine the oxidized or inflammatory version of vitamin C, because if someone has that and they don't have cancer, but they do have this oxidized inflammatory form of vitamin C, that's probably worsening their health problem. Now, if someone has cancer and they're receiving intravenous vitamin C, and I'm going to repeat this because you're almost never going to hear this anywhere, but it's a fact. You can look it up at pubmed.org under intravenous vitamin C and cancer. How does it work? And we know that if a cancer person is getting intravenous vitamin C, we want that vitamin C intravenously to act as an oxidant. We don't want vitamin C intravenously to act as an antioxidant. No. We need it to function as an oxidant. And that's what dehydroascorbate is. That's the oxidized form of vitamin C. So if we see the deoxygenated or dehydroascorbate form of vitamin C in the urine in someone with intravenous vitamin C therapy, then we know that that's what we need to do. That's exactly right. All we need to do now is also measure their blood levels to make sure that the intravenous vitamin C that they're getting is the amount consistent with the anti-cancer doses in the studies. And I also like to use blood lactic acid levels. So lactic acid is a byproduct of anaerobic metabolism, which occurs in the body when it's undergoing intense physical activity or experiencing stress. And we know that high levels of lactic acid in the blood can lead to fatigue, muscle soreness, and other health problems. And another one of my favorites is the blood nitric oxide level. So nitric oxide is a signaling molecule that plays a critical role in blood flow and circulation. So if you have low levels of nitric oxide in the blood, that will lead to decreased blood flow to the muscles, which can cause pain and fatigue and other health problems. And if you give the right nutrition to raise nitric oxide levels, for example, like arginine, then you will know you've done it because the level of nitric oxide in the blood will increase. And another really essential urine test for anyone looking into nutrition for any reason whatsoever, as far as I'm concerned, is indican. Before I tell you about indican, just my contact information for those of you who would like it. It's Dr. Michael Wald. You can reach me by calling 914-552-1442. My email is info@blooddetective.com, and my website is drmichaelwald.com, drmichaelwald.com. So urinary indican, is a metabolite of tryptophan, an amino acid that's essential for sleep and mood regulation. And high levels of indican in the urine can indicate a deficiency in tryptophan or a problem with the body's ability to metabolize tryptophan, which can lead to fatigue, anxiety, and other health problems. Also, if the indican is high, that might also indicate general malabsorption as well, and indirectly many other nutritional deficiencies. There's a great test that can be measured in the blood called malonyl-dialdehyde. So malonyl-dialdehyde is a byproduct of oxidative stress, which can occur in the body when exposed to free radicals or other inflammatory forms of let's say, damage. And high levels of malonyl-dialdehyde, abbreviated MDA, in the blood can lead to fatigue, inflammation, and many health problems. So it's high in most problems. So you want to make sure it's coming down. You want the malonaldehyde to come down. You want the pH to balance. You want the excessive calcium to go away. You want the vitamin C levels to come up. You want the malabsorption marker to go down. There's different ratios of how we want these tests to go. So maybe the last one I'll end with today is urine calcium levels, because the urine can indicate, particularly when there's calcium in it, problems with the body's ability to obviously regulate the calcium levels. And the body's attempting to do that. Let's say the blood levels are too high, by getting rid of some calcium in the urine as the blood filters through the kidneys and then takes the urine out. So because if that calcium accumulates, it can lead to fatigue, muscle cramps, and many, many other health problems. So what you've heard today, and what I've hoped that you can appreciate, is there are many different causes of fatigue, and they're almost never exclusive. People usually have more than one cause of their fatigue, and diet is almost always at the base, or is fundamental to almost all causes of fatigue. Even if someone's fatigue wasn't caused initially by nutritional problems like nutritional deficiencies or insufficiencies, chronic health problems hyperutilize nutrition and affect nutrient balance. So whether nutrition is a cause or whether nutrition is nutritional issues and fatigue is a result of the condition, either way, nutrition has a role. Let me just say that again. Either nutritional problems cause most of our fatigue, or many of the causes of our fatigue will result in nutrition problems. I thought and I hope that this would be useful for all of you today. Let me know your thoughts. You've got my contact information. This is Dr. Michael Wald. You're listening to Ask the Blood Detective, and we'll see you next time on another great show.